Care of patients standards. The clinical alarm system management. Getting started of alarm management begins with having a good team in place, and having a correct data. There are so many alarms and they are so often false, or not actionable, that nurses and other clinicians are beginning to become desensitized to, or ignore alarms. They turn them off. That has led to missed true patients events. So it's a patient safety issue that trying to address. FJH leaders ensuring that the clinical alarm systems program identifies the most important alarm signals to be managed based on the risk to patient safety. Medical devices alarms 24 hours a day and many times for non-actionable reasons. The purpose of clinical alarm is to enhance safety. They alert when the patient's condition is deteriorating or when a device is not functioning properly. A perfect alarm system would never miss a clinically important event. That means it would be a highly sensitive and it would never alarm when there's no clinically important event. But their high sensitivity is achieved at the expense of specificity, and there are a lot of false alarms which can lead to alarm fatigue. Strategies to manage clinical alarms. Clinically appropriate settings for alarm signals. Situations in which alarm signals can be disabled. Circumstances under which alarm parameters can be changed. Unit doctor or nurse in charge authorized to set or change alarm parameters. Before disabling the clinical alarms, consult with the treating physician. Consider the patient hemodynamic status, and review the defaulted parameter setting. The Laser Management Safety Program. Lasers find wide application in various fields. Lasers have the potential to cause serious injuries or permanent disability if precautions are not taken to ensure safe operation. FJH ensuring the safe use of the facility's medical laser equipment, and to credential physicians and staff for use of lasers in the hospital as per local laws and regulations. And to ensure the patient's safety in regards to laser procedures, provide optimum and effective use of the laser. Laser technician or competent nurse responsibilities. Set up the laser equipment, ensuring correct laser, signage, eye protection and other protective measures are in place according to the manufacturer's guidelines. Liaison with the laser safety operator on any matters related to laser hazard and safety identification and evaluation. Ensure safe work practices, staff training, safety equipment and control measures, in conjunction with staff using lasers based on level of responsibility. Precautions for safe operation. Establish a controlled area for laser operation, limit access to those trained in the principles of laser safety. Post warning signs prominently near entrances to the laser operation area. Set up shields to prevent the beam from escaping the laser operation area. Keep the protective cover on the laser head during operation. Enclose the beam path whenever possible. Keep the laser beam either above or below eye level. Do not look at the beam directly or as reflected by a mirror or polished surface. When working with a Class 4 laser, do not expose skin to beam. The high-risk patients and services. High-risk and vulnerable patients. A high-risk patient who is subject to a particular real or potential danger or hazard. And the vulnerable patients includes elderly patients 65 years old and older, dependent children, and patients at high risk for abuse and/or neglect. The high-risk category group will be identified, assisted, and given appropriate care as per their needs and requirements. All identified high-risk patients as per policy at FJH shall be treated according to their specific needs to guarantee best care and to minimize potential risks. Qualified and specially trained staff are available for handling high-risk patients and during high-risk services and respond to changes in patients' condition and to report accordingly. The pain management. To provide effective physical, psychological, and pharmacological relief for patients with pain due to end-stage illness, acute, chronic, intractable pain or any other type of pain. Guidelines assist professional staff in alleviating patients' suffering and improving quality of life. Attending physician and assigned nurse responsibilities. All patients shall be screened for pain at the time of initial assessment. The scope and complexity of care shall be determined through the assessment and evaluation of patients currently experiencing or expecting to experience pain symptoms. Assessment criteria used to establish the patient care needs may include clinical presentation, diagnostic testing, patient interview, the patient's past experience with pain, and information obtained from significant others. Pain rating and pain assessment. The pain will be assessed the first time the patient visits the hospital and documented. If pain score is equal to 3 or more, then pain management will be done. If pain is mild to moderate, pain medication prescription can be provided. If pain is severe, pharmacological pain management will be done, and reassessment will be done after the intervention in AE. In the OPD, the further pain management will be decided by the treating physician. In the inpatient, the presence of pain shall be assessed on admission to the hospital and documented in the pain assessment module in the patient's EMR. If there is any presence of pain with a score of 3 or above, then a more comprehensive pain assessment will be carried out. The patient will be reassessed every 8 hours for pain. Pain scale in EMR. The numerical rating scale, above 13 years old. The Wong-Baker Faces Pain Scale, WBF, for children between 7 to 13 years, and all patients in recovery room. The FLAC scale for children between 2 months to less than 7 years. The NIPS for pre- and full-term neonates. The Behavioral Pain Scale, ventilated, unconscious patient. Reassess for pain. Oral analgesia, maximum 1 hour after administration. Parenteral analgesia, maximum 30 minutes after administration. Cardiac pain should be reassessed every 5 minutes whenever the treatment prescribed warrants the use of nitrates or intravenous medication to manage pain. The suicide or self-harm risk assessment and management. To promote safety by effectively identifying service users who are at risk of suicide and self-harm through an assessment and reassessment process. And to ensure all healthcare workers are aware of the suicide and self-harm procedures at FJH. Treating physician responsibilities. To assess for suicidal ideations and any recent suicidal attempt using the CSSRS and BSS tools. The CSSRS tool, mild risk, routine referral for further psychiatric, psychological assessment and support. Moderate risk, urgent referral for further psychiatric assessment and treatment. Severe risk, urgent referral for further psychiatric assessment and treatment. The BSS tool, score 0 to 10. Low risk, to be sent home with advice. Score 11 to 20, medium risk, to be referred to a psychiatrist for further assessment. Score 20 to 30, high risk, urgent referral for further psychiatric assessment and treatment. Healthcare provider responsibilities. Ongoing monitoring of the person's status will include brief screening for changes to level of risk, mitigation of immediate warning signs, and development or engagement in protective factors. Monitoring and reassessment is essential during, every 24 hours, transfer to another facility, MRP changed, patient condition changed, before discharge from the hospital. Environmental safety. The environment must be inspected on a regular basis, any unsafe situations or equipment must be dealt with or removed at once. If a patient makes a suicidal attempt within 72 hours from discharge, this should be reported as a sentinel event. The blood and blood products administration and use. To ensure safe and effective blood transfusion administration, and to ascertain staff are fully aware about the risks and benefits of blood products in FJH. Doctor responsibilities. Obtain informed consent for a blood transfusion, and in case of refusal the doctor shall document in EMR, LAMA and RAMA form. Request order form for blood transfusion order, type of blood component, quantity, duration and rate of infusion and signature of prescriber. Ensure that the blood is not warm for routine blood transfusion. Patients receiving transfusion should be monitored for symptoms/signs of the potential complications of transfusion. Staff nurse responsibilities. Ensure blood or blood component request order includes 2 patient identifiers, and ensure it is not stored in a ward drug fridge under any circumstances. Check physician's order, and blood unit for identification, ABO, and RH on blood unit cross-match label, cross-match report, recipient and blood unit, expiration date of blood unit, compatibility test results. Ensure all blood components are transfused as per policy of blood and blood administration. Staff nurse responsibilities in case of transfusion reaction occurs. The uniformity of patient care. To establish procedures for the development, implementation, and review of treatment plans for each patient in FJH. An individualized plan of care for each patient is developed by the patient care team. To delineate policy for the planning and providing of patient-specific care, medication use, nutrition care, care during operative and other invasive procedures, rehabilitation care, and care during special procedures including restraint or isolation. The attending physician responsibilities. Initiates data collection, assessment, and planning in the patient's continuum of care no later than 24 hours post-admission. Initial assessment and reassessment to be carried out as per policy. All the clinical orders shall be written in EMR with the clinical indication except emergency orders or life-saving situation. The care planning process is an interdisciplinary, collaborative process and is integrated into patient's care across the continuum. Consider patient's age-appropriate interventions to meet his needs. Ensure that the treatment plan is to be based on the results of a comprehensive, multidisciplinary assessment. Make sure that the integration of the plan will be accomplished through collaboration with various disciplines or departments. Consider that the planning and provision of care is driven by consideration of the rights of patients. Review and update patient progress is periodically evaluated.